Yeah, thank you. I'll be talking about basically the core of the femto procedure, which is the nucleotomy, as to what exactly, how you can alter the nucleotomy. And when you're looking at doing a nucleotomy in femtosecond cataract procedures, you can have cases which are extreme hard cataracts and you can have cases which are extremely soft. And it works excellently in both of these, and I'll be talking about this. Now, femtosecond nuclear fragmentation essentially is effective to disassemble the nucleus. So you have on your table, as Dr. Keki said, half the work done. So you have the nucleus which is kind of pre-chopped. And what you have in addition is to retain a part of the posterior part or the posterior plate so that you do not have a nucleus drop. Depending on your comfort with the laser, you could be losing anywhere between 500 to 800 microns. In posterior polar cataract, the OCT image clearly shows as to where you need to be, and then therefore you can lead more. Now when you are looking at lens fragmentations, these are the type of fragmentations that you can do, which could be, you could make just pure quadrants, or you could make sextants, or you can make octants. And then in addition to that, you could have softening of the nucleus, wherein you are leaving these quadrants separate and there is a small area outside the quadrant which you go and soften. Now in the catalyst system, this softening extends up to 1 millimeter from the pupil. So it can go beyond the rexis, but it will stop short of the pupil by about 1 millimeters. Now this is what it is, and this is the new technique, which is the matrix pattern which you have in the Lensex machine. So I have used two machines extensively, the Lensex and the Catalyst, and I did do one case on the Lens AR. I haven't used the Victus. So when you are looking at the lens fragmentation, you can see that across all grades of cataract, I'll be showing you some, Dr. Keki showed you, and you can fragment whether it's a elastic, brown, black, or a soft cataract with this. Now the second thing that I told you was in the Lensex system, which is called as the matrix pattern. Initially when the Lensex came, it only came with the chops, that is the 4, 6 or 8. But now what you can do is that you can make these small cubes and then you have horizontal zero cut. You could also add one horizontal cut, or you could add two horizontal cuts. So actually you get small little cubes which can only be aspirated out rather than cutting it. So this is the matrix pattern which the Lensex has. I'll just show you the first initial things that you had, which is the normal chopping procedure. This is the mark for a toric lens, wherein instead of putting a mark, you can make intrastromal marks in the cornea. Now this is the docking that you can see. This is the docking that is being done. Once you have it at the green rider, you can center it, and this is a 4-quadrant split that you will have. Now go ahead on this. This is a cyclorotation. You can see that with the mark there was a slight cyclorotation on docking. So we are cyclorotating so that the axis is perfect as you want. This has been docked. Now this is the OCT image that you have. And this is the nucleus that you are going to fractionate. The yellow portion is the nucleus that you are going to fractionate. This is the OCT for the triplanar incision. This is for the arcuate incision. These two, these are not LRIs but marks. And this is the thickness of the cornea that comes into play. Now once you have everything set, you just press, and this is the capsulotomy that has happened. And you can see that this is the simplest, most old, I would say, that is the divide and conquer technique which is happening. This is showing you, the yellow bar is showing you the nucleotomy that is happening, and it keeps coming from below upwards. And you can see that this is a 4-quadrant crack that one has been able to establish. Primary incision that is coming in, and this is the secondary incision. These were the two arcuate that you see. So if you see here, you have split the nucleus into 4 quadrants, almost a free-floating capsulotomy. You can easily pull it out, and all you need to do is, because it's a soft cataract, you break it into 4 pieces and you suck out the nucleus very easily. And that is the cortex that is being taken out. So this is the first way how you would want to disassemble a nucleus where you are not away from what you used to do in a phacoemulsification. Now there are several studies that have shown that the intention to treat these patients is to reduce the quantum of phaco energy that is being used, and the effective phaco time, as you can see, was 70% reduced in the femtolaser, which is statistically significant. This has been reported by Hay, Shehi et al. Now, when you go on up the ladder, then you see the effect more, and if you come down the ladder, so this is down the ladder, what this study has shown that less than 0 second phacoemulsification time after what you have done in the femto could be achieved in 13% of the cases and was achieved only in 0.5% of the cases in phacoemulsification. Do you understand? These are softer cataracts. I will show you how you don't actually need any phacoemulsification power. You just need an aspiration that is required, and you can reduce the phaco time to almost 0 in 13% of the cases. Now this is the procedure that is described, which is called as viscodissection. This is on the catalyst machine. So you can see this is the lock. As you have done, this is the OCT image that you get the cornea, and you have worked now. This is the capsulotomy, nucleotomy, and here you can see we are having a nuclear softening, and we are going to have the 4 quadrants. Now this is a soft nucleus, so when you press, you can see the capsulotomy is done. This is the fastest capsulotomy which you can do in about 1.5 seconds. You can reduce it to even 1 second. This is the nuclear fractionation that is happening with the catalyst machine. And as you go forward, those are just air bubbles that have come. That is the primary incision that is coming on. And then you see you have the secondary incision. The idea here is to show you that you have a free-floating capsulotomy. You saw that the capsulotomy was already detached. Now this is viscoelastic that is being put. Can you see? And with viscoelastic, we have just broken it, and you don't really need to do anything but just aspirate it out. So could you see this particular thing, that in a softer cataract you can actually viscodissect the nucleus and you can remove and disassemble the nucleus in softer cataracts. Now let us move on to what I talked to you. This is the matrix pattern that you have. So here again you can see that this is the small cubicles. This is the OCT image that you have got. This is the amount of nucleus that you are going to fractionate. This is the LRI. You can see this is the so we go ahead and you can see that you press on the foot switch. This is the capsulotomy that is happening. There you see the capsulotomy. Now watch the matrix pattern. Now when you're looking at the matrix pattern, you can see that there are cuts that are coming in. Can you see this? This is a matrix pattern. That is the horizontal cut. Did you see that horizontal cut coming? And then you see the second horizontal cut. So do you understand? You had the whole thing going down and you have the horizontal cuts that are coming in. So you actually have very small little pieces which you can go ahead and aspirate. So again, I'll just go to towards the end. So you can see this is again very clear. You can just go ahead and do a gentle aspiration with very little phacoemulsification time. Now, the effective phacoemulsification time, when you go on to harder cataracts, that is where it comes down. So if you look at NS4, you can see that the phacoemulsification time, when you see which is in the conventional group versus the group that you have on femtosecond, is significantly different and much more. Now this is to just show you an earlier case that I used to do with the Lensex. This is the hard cataract. You can see the capsulotomy has been come out well and we have removed the capsule. Now you can see this has been made into small quadrants. It is not a matrix pattern. And just watch this. As we are disassembling the nucleus, you will see a gush of air bubble. So what it means is that the nucleus had been cut below to the posterior plate, and that is why you could see that we are able to disassemble a very brown black cataract, and we can easily remove this. And again see, you can see that this is already cut and is already disassembled. So the quantum of energy, as you can see in this particular case that you are using with femtosecond, is significantly lower because you had already pre-chopped the nucleus into small little pieces. And this is the same patient post-op day 1, vision 6-9 aided. You would not get such a crystal clear cornea if you were looking with a phacoemulsification alone. So what has been shown by several studies is that the amount of softening that you do is going to reduce the amount of phaco time. And what it has been also shown is the central corneal thickness is lower in femto cases as compared to phacoemulsification. That means that the amount of edema that you get is less, though it has not translated to a significant difference in the endothelial cell loss as things stand today. And it has also shown that the aqueous flare and the CME is less. So in our experience, you have now several patterns. As the technology evolves, there are several patterns. I'm not showing you the posterior polar, but we have another talk in Cyrus Mehta where we'll be talking about posterior polar as to how this gives excellent results in posterior polar. Now, one thing for you to remember is that if you have a white mature cataract, nothing of femto is going to work, means as regards the nucleotomy. You will have a fantastic capsulotomy, you can have the incisions, but because you don't have a transparent medium through which the femto can go down and focus, it cannot cut a white cataract. So a white cataract, you could put the nucleotomy off because it is not going to cut it. But apart from that, if you have a see-through cataract, it could be a grade 4, grade 5 cataract, you could disassemble that cataract. And we feel that in our experience, it simplifies even the complex cases, gives you better immediate post-operative outcomes, and the patients are happier, and so are the surgeons with their outcomes. Thank you very much for your kind attention.